Are you tired of feeling tired? Struggling to get a good night's rest? Discover the science behind sleep and how simple lifestyle changes can transform your nights and your days. Learn how to sleep better, feel more energized, and improve your overall well-being with proven strategies. Sleep is more than just a time to rest. It's essential to your health, your mood, and even your productivity. In The Sleep Solution, Drive W. Chris Winter, a leading sleep researcher, reveals the hidden truths about sleep, from the stages of rest to the impact of sleep hygiene. Whether you suffer from insomnia or just want to optimize your nightly routine, this audiobook provides actionable insights that can help you reclaim the rest you deserve. You'll learn how to distinguish between tiredness and sleepiness, the key stages of sleep, and how to set up a consistent sleep schedule that works for you. From snoring to sleep apnea, we'll explore the solutions that will help you sleep more soundly and wake up refreshed. Focus points. Understanding sleep. Discover why sleep is a primary driver for good health and performance. Fatigued versus sleepy. Learn the difference and how it affects your daily energy. The 3 stages of sleep. Understand the vital stages your body goes through each night. Debunking sleep myths. Separate fact from fiction when it comes to your sleep habits. Healthy sleep hygiene. Develop habits that promote deep, restorative sleep. Conquering insomnia. Understand what insomnia is and how to overcome it. The power of napping. Learn when naps are beneficial and how to use them for better health. Snoring and sleep apnea. Discover effective treatments for snoring and apnea. Creating a sleep schedule. How a consistent routine can revolutionize your sleep. Learning outcomes. Differentiate between fatigue and sleepiness and identify which one is affecting your day-to-day life. Build a personalized sleep hygiene routine to improve your sleep quality. Uncover the real causes of insomnia and practical solutions to overcome it. Gain insights into the importance of napping and its role in enhancing productivity. Master the art of creating a sleep schedule that aligns with your natural circadian rhythm for better health and energy. Explore the science behind sleep apnea and snoring and learn about available treatments. Achieve a restful night's sleep consistently, leading to improved mental clarity, physical health, and overall quality of life. This audiobook will guide you toward the restful nights and energetic days you've been seeking. It's time to unlock the secrets of sleep and make every night count. Focus point 1. Sleep is a primary driver for health and well-being. Sleep is not just a passive activity. It's a vital, active process that plays a central role in maintaining the health of our bodies and minds. Yet many people overlook its significance, failing to realize how critical sleep is for their overall well-being. Just like food and water nourish the body, sleep is a fundamental drive that allows us to function at our best. It is deeply intertwined with nearly every physiological process, from energy regulation to emotional stability, making it one of our primary drivers for survival. When we sleep, our bodies carry out essential functions that cannot be performed while awake. One of the most significant processes occurs in the brain's glymphatic system, which is responsible for clearing out waste products that accumulate throughout the day. This system operates most effectively during sleep, particularly deep sleep, highlighting how crucial rest is for brain health and cognitive function. A lack of sleep impacts many aspects of our health. Without enough rest, our energy reserves dwindle, prompting the body to seek quick energy sources, typically through overeating or poor food choices, which can lead to weight gain. Additionally, poor sleep negatively affects heart health. The heart depends on a rhythmic, synchronized beat to pump blood effectively, and this rhythm is disrupted when sleep is inadequate. Over time, this can increase the risk of cardiovascular issues. Sleep also has a profound effect on our mood. Insufficient rest can trigger irritability, mood swings, and emotional instability. The brain requires sleep to process emotions and maintain mental balance, so chronic sleep deprivation often leads to negative emotional consequences. Humans, like all animals, have basic instinctual drives that ensure our survival. These drives, such as hunger, thirst, reproduction, and sleep, are essential to keeping the body functioning optimally. When we neglect one of these drives, especially sleep, our bodies begin to show signs of stress, both physically and mentally. Contrary to the belief that some people can function well without sleep or that a lack of sleep won't impact productivity, the reality is that everyone needs rest. While the exact amount of sleep required varies from person to person, the key is ensuring that you are getting enough quality sleep each night. Research has consistently shown that sleep deprivation has wide-ranging negative effects, from cognitive decline to increased risk of chronic diseases. The good news is that by understanding the importance of sleep and making it a priority, we can overcome many of the symptoms associated with poor rest and begin to experience better health, energy, and emotional well-being. Focus point 2. Discerning between sleepy and tired. To truly understand and address your sleep challenges, it's essential to differentiate between being tired and being sleepy. These terms are often used interchangeably, but they represent distinct conditions with different underlying causes and solutions. Fatigue versus sleepiness. Fatigue is not the same as sleepiness, although many people mistakenly treat them as one and the same. Fatigue refers to a deeper, more persistent sense of exhaustion that doesn't necessarily require sleep to alleviate it. Instead, fatigue may be related to a variety of physical or emotional factors, such as malnourishment, stress, depression, chronic conditions like diabetes, anemia, or even pregnancy. While rest may help, fatigue is not instantly resolved by sleep, and it often requires more comprehensive attention to underlying causes. In contrast, sleepiness is a primary drive, a natural physiological urge to sleep that signals your body needs rest. Sleepiness is more straightforward. When you feel sleepy, you must sleep. Your body's internal systems are telling you that sleep is necessary for recovery, replenishment, and overall well-being. The role of the homeostatic and circadian systems. Two systems in your body work together to regulate your need for sleep: the homeostatic system and the circadian system. The homeostatic system acts like an internal hourglass that steadily builds up the need for rest throughout the day. As you stay awake and expend energy, this system accumulates its sleep debt. The longer you're awake, the stronger the drive to sleep becomes, reaching a threshold at night when the need for rest becomes overwhelming. On the other hand, the circadian system is akin to an internal clock that operates on a roughly 24-hour cycle, aligning with the external environment, most notably the presence or absence of light. This system controls your sleep-wake patterns, helping to dictate when you feel sleepy or alert. When the evening approaches, the circadian system prepares the body for rest by lowering your core body temperature and triggering the release of sleep-inducing hormones like melatonin. When these two systems are functioning in harmony, your sleep-wake cycle follows a natural, predictable rhythm. However, when they become misaligned, due to factors like inconsistent sleep schedules, exposure to light late at night, or disruptions like jet lag, it can lead to trouble falling asleep at night and struggling to stay awake during the day. Practical tips for managing sleepiness. Understanding the difference between being tired and being sleepy can help you manage your sleep better. For instance, sleepiness is a clear signal from your body to go to bed, while fatigue may require you to address the root cause, such as improving nutrition or managing stress. To optimize your sleep and avoid disrupting your circadian rhythm, consider these tips. Follow a consistent sleep schedule, even on weekends, to keep both your homeostatic and circadian systems in sync. Limit exposure to screens an hour before bedtime, as blue light can interfere with melatonin production and disturb your natural sleep cycle. Ensure you're getting enough sleep each night to allow both systems to function properly, leading to better energy levels and improved overall health. When these systems are aligned and functioning well, your body will respond by providing restful, restorative sleep that supports your health and well-being. As Drive W. Chris Winter puts it, your body is doing amazing things at night while you sleep. Focus point 3. The 3 stages of sleep. Sleep is a complex and multi-phase process that unfolds through 3 distinct stages. Each stage plays a critical role in ensuring that the body and mind get the rest they need to function optimally. Understanding these stages can help you better appreciate the importance of sleep and how to improve your sleep quality. Stage N1. Light sleep. The journey into sleep begins with stage N1, also known as light sleep. This stage marks the transition from wakefulness to sleep, and it's characterized by a gradual slowing down of the body's processes. As you fall into this light sleep, your muscles relax and your heart rate and breathing begin to slow. This stage is relatively brief, lasting only a few minutes. During stage N1, your body starts to loosen its grip on wakefulness, but your mind remains somewhat alert. You may experience sensations like a falling feeling or muscle jerks, which are common during this stage. While this phase is essential, it's only a precursor to deeper stages of sleep. Stage N2, deeper sleep. Next comes stage N2, a deeper and more restful phase of sleep. By this stage, your muscles are fully relaxed and you are no longer aware of your surroundings. This is where the body enters a true state of rest, though light levels of awareness may still linger. Your body temperature drops, your heart rate slows further, and brain activity shifts into patterns that prepare for restorative sleep. Stage N2 comprises about 45 to 55% of your total sleep time, and it plays a significant role in memory consolidation and overall mental rejuvenation. Stage N3, deep sleep. Deep sleep, also referred to as slow-wave sleep or SWS, is one of the most restorative phases of sleep. During this stage, the body performs essential repair and recovery functions. It's during deep sleep that the body strengthens muscles, rebuilds bones, and strengthens the immune system. Growth hormones are released and the body's energy reserves are replenished. Deep sleep is particularly vital for physical restoration, and its benefits are most noticeable when you experience sufficient amounts of it each night. However, this stage tends to decrease with age, meaning that older individuals often experience less deep sleep. REM sleep, dream sleep. Although not one of the three core stages, REM, rapid eye movement, sleep is a crucial part of the sleep cycle. REM sleep occurs after deep sleep and is characterized by rapid eye movements, increased brain activity, and vivid dreams. It is the stage where your brain is most active, processing emotions, forming memories, and consolidating learning. Although not all sleep cycles include vivid dreams, REM sleep is where they typically occur. Interestingly, the brain remains highly engaged during this phase, despite the body being physically still, which demonstrates the paradox of the sleep state. The sleep cycle. A healthy sleep cycle follows a predictable pattern. Wakefulness. Stage N1, light sleep. Stage N2, deeper sleep. Deep sleep. Stage N3, REM sleep. The cycle repeats itself several times throughout the night, with each cycle lasting roughly 90 minutes. As the night progresses, deep sleep becomes less frequent, and REM sleep becomes more dominant in the latter part of the night. Vigilance and sleep quality. One factor that can significantly disrupt the sleep process is vigilance, the state of being overly alert or on high alert, which makes it difficult to fall asleep. Too much vigilance, whether due to stress, anxiety, or external factors, can prevent you from entering the deeper, restorative stages of sleep. Many people resort to sleep medications that provide temporary relief, but these often interfere with the natural sleep cycle. For example, drugs that stimulate dopamine and histamine may help induce sleep in the short term, but they can lead to dependence and long-term sleep dysfunction. To truly address sleep dysfunction, it's important to recognize the root causes, whether physical, mental, or environmental, and seek professional help if necessary. Maintaining a balanced approach to vigilance and sleep is key. Too much vigilance leads to sleeplessness, while too little leads to impaired cognitive and physical restoration. Ultimately, understanding the different stages of sleep, how they work together and how to support them, can improve the quality of your rest and have a profound impact on your overall health and well-being. Focus point 4. Misconceptions about sleep. There are several misconceptions about sleep, and one of the most common is the belief that it's possible to go without sleep for extended periods. Many people claim to have gone months without sleep, but the truth is that these claims are often linked to a condition known as paradoxical insomnia. This condition occurs when someone believes they aren't sleeping even though they are. The individual may recall events or experiences that occurred during the night, but these memories are not indicative of full wakefulness. They may remember thoughts or images as time passed, giving them the false impression that they weren't sleeping. Paradoxical insomnia is particularly challenging to address because those who experience it often become fully immersed in the belief that they are not sleeping. This conviction leads to distress, anxiety, and feelings of unproductiveness, which can further exacerbate the condition. It's crucial to recognize that it's not normal to feel as if you haven't slept when in fact you have. The best first step in overcoming this problem is to accept the possibility of paradoxical insomnia. This acceptance can reduce the distress it causes, paving the way for better treatment and improved sleep habits. Another misconception involves circadian rhythms, which are responsible for regulating the timing of our sleep-wake cycle. The circadian system acts like an internal clock, signaling when it's time to be awake and when it's time to sleep. This system is synchronized with external cues like daylight, which helps regulate sleep patterns. However, when we consistently override this natural rhythm, by staying up late, working night shifts, or eating at irregular hours, we disrupt the body's internal clock, leading to difficulty falling and staying asleep. Circadian rhythm disorders are a common result of such disruptions. These disorders can occur when the body is forced to adjust to a new schedule, such as when traveling across time zones. For example, if you travel from one country to another and there's a significant time difference, say 6 hours, it can be difficult to sleep during the initial days in the new time zone. Your body must recalibrate itself to align with the new environment's day-night cycle, which can cause sleep disturbances. Similarly, significant life changes such as starting a new job or adjusting to a different work schedule can throw off your circadian rhythm. The body needs time to adjust, and this can lead to sleep problems if not managed properly. The key to overcoming circadian rhythm disorders is gradually re-establishing a routine that supports your body's natural sleep-wake cycle. Tips to correct circadian rhythm disruptions. Establish a consistent wake-up routine. Make a point of getting up at the same time every day, even on weekends, to reinforce your body's natural rhythms. Exposure to sunlight. First thing in the morning, expose yourself to natural light. This helps reset your internal clock and tells your body that it's time to be awake. Avoid stimulants and electronics before bed. Reducing exposure to screens and caffeine helps signal to your body that it's time to wind down. In summary, dispelling misconceptions about sleep such as believing you can go without sleep for long periods or ignoring the impact of circadian rhythms is essential for improving your sleep quality. Understanding the complexities of sleep and the importance of maintaining a regular routine will lead to better overall health and well-being. Focus point 5. Developing healthy sleep hygiene. Good sleep hygiene is crucial for maintaining quality sleep, and it involves establishing habits and creating an environment that promote restfulness. It's about adjusting both your routine and surroundings to support your body's natural sleep patterns. Whether you're dealing with a busy schedule, shift work, or just occasional sleep struggles, there are several techniques you can apply to improve your sleep hygiene and ensure a restful night. Here are some practical tips to help you develop better sleep hygiene. 1. Create a hibernation layer. A dark, quiet room is essential for optimal sleep. The brain is highly sensitive to light, which can disrupt your circadian rhythm and prevent you from falling asleep. Ensure your bedroom is as dark as possible. Consider blackout curtains or an eye mask if needed. Noise is also a significant disruptor, so try to eliminate any sources of sound such as TVs, radios, or noisy neighbors. If your environment is noisy and you can't control it, white noise machines or earplugs can help block out distractions. Finally, turn off all electronic devices such as smartphones, tablets, or computers, which emit blue light that interferes with melatonin production and sleep quality. 2. Get cozy in your crib. Comfort is key to a good night's sleep. Invest in a mattress and pillows that provide support and comfort to your body. An uncomfortable bed can lead to restless nights and even back or neck pain, which in turn makes it harder to develop healthy sleep hygiene. Pay attention to the texture of your sheets, the room temperature, and any other environmental factors that may affect how comfortable you feel as you drift off to sleep. 3. Find a peaceful place to sleep. If you share a bedroom with a partner or family members, it can be difficult to maintain a perfect sleep environment. If your partner snores, leaves the light on, or engages in other sleep-disrupting behaviors, consider using earplugs, a sleep mask, or even sleeping in a separate room if possible. If that's not feasible, having a dedicated sleep zone with calming elements, such as soft lighting or soothing music, can make a big difference. 4. Avoid bad habits that keep you from sleeping. Relying on stimulants such as caffeine, nicotine, or certain medications can interfere with your ability to fall and stay asleep. These substances can remain in your system for hours, so it's crucial to limit their use, especially in the hours leading up to bedtime. Similarly, using drugs or alcohol to sleep may provide temporary relief but can lead to disrupted sleep cycles and worsen sleep quality over time. Instead, allow your body to learn how to fall asleep naturally without relying on external aids. 5. Watch your diet and sleep. Your eating habits play a significant role in your sleep quality. Eating heavy, rich foods or large meals right before bedtime can cause indigestion, discomfort, or acid reflux, making it harder to fall asleep. Ideally, you should avoid eating at least 1 to 2 hours before bed to allow your body time to digest. Also, be mindful of foods and beverages that can disrupt your sleep, such as spicy foods, caffeine, or alcohol. On the other hand, lighter snacks that are rich in tryptophan, such as turkey or a banana, can promote better sleep by supporting the production of serotonin, a hormone that regulates sleep. 6. Recognize and adjust what hinders your sleep hygiene. Good sleep hygiene is about consistently recognizing and addressing anything that negatively impacts your sleep. Take note of the factors that disturb your sleep, whether it's noise, light, temperature, or bad habits, and take steps to correct them. Small adjustments, like adjusting your bedtime, creating a more soothing environment, or cutting down on late-night screen time, can make a big difference in how well you sleep. Incorporating these tips into your routine can help you build a strong foundation for restful, restorative sleep. Whether you're facing sleep difficulties due to work, lifestyle, or stress, focusing on sleep hygiene can lead to significant improvements in both your sleep quality and overall well-being. Focus point 6. The pit of insomnia. Insomnia is often misunderstood. The general belief that it simply refers to a lack of sleep is not entirely accurate. While it's true that everyone experiences occasional nights of poor sleep, the term insomnia refers to a chronic inability to fall or stay asleep, accompanied by frustration and distress about the situation. Understanding insomnia. Insomnia isn't just about being unable to sleep. It's about being unable to sleep when you truly want to and the emotional burden it causes. It is a combination of two elements. The inability to sleep. Despite your best efforts, you cannot fall asleep, even though you are tired or desire rest. Emotional distress. The inability to sleep becomes a source of significant concern, leading to frustration, irritability, and a sense of helplessness. There are two main types of insomnia: simple and hard insomnia, each requiring different approaches for management. Simple insomnia. Simple insomnia is often triggered by stress, anxiety, or minor medical conditions. The root causes may include worries or cognitive patterns that keep you awake at night. For example, anxieties about work, relationships, or life situations can keep the mind racing, preventing relaxation and sleep. In most cases, addressing these worries and adopting relaxation techniques, such as deep breathing, mindfulness, or stress management, can help improve sleep. Once you clear your mind and stop overthinking, you may find yourself able to sleep better. Hard insomnia. Hard insomnia, on the other hand, is much more concerning. It is driven by deep-seated fear and feelings of helplessness. When you feel trapped in a cycle of anxiety about not being able to sleep, the fear of never getting rest can exacerbate the issue, making sleep even harder to achieve. This cycle of worry can lead to a sense of powerlessness, further deepening the problem. It's crucial to recognize that sleep is a skill, and like any skill, it can be developed over time. If you struggle with insomnia, don't allow frustration or fear to dominate your thoughts. With time, patience, and the right approach, you can regain control of your sleep habits. However, in rare cases, prolonged insomnia that remains unresolved can have serious long-term effects, including the potential for cognitive decline or conditions like dementia. The role of sleeping pills. While sleeping pills may offer temporary relief, they do not address the root causes of insomnia and can lead to dependency. The cycle of relying on medications to sleep might bring comfort in the short term, but when the medication is no longer available or effective, it can worsen the problem. This can lead to a dangerous cycle of addiction or reliance on these substances. If you find yourself dependent on sleeping pills, it is important to seek professional help. Your doctor can provide guidance on how to gradually reduce reliance on medication and explore alternative treatments for insomnia. Before using any sleep aid, it's wise to consult a healthcare professional to understand its benefits, risks, and proper usage. In summary, insomnia is more than just a lack of sleep. It is a distressing condition that requires a careful approach to manage. Whether through cognitive behavioral therapy, stress management, or professional support, addressing the root causes of insomnia is key to restoring healthy sleep patterns and emotional well-being. Focus point 7. Creating sleep schedules. One of the key components of improving sleep quality is developing a consistent sleep schedule. People who struggle with sleep often don't have a fixed time to wake up or fall asleep, which can lead to erratic sleep patterns and difficulty maintaining a healthy circadian rhythm. Importance of a fixed sleep schedule. A fixed wake-up time is crucial for regulating your body's internal clock. If you wake up at different times each day based on how well you slept the previous night, it can throw off your rhythm and make it harder to stay alert and refreshed. By establishing a consistent sleep and wake time, you can ensure that your body knows when it's time to sleep and when it's time to wake up. While you may hear about recommended sleep durations, it's important to understand that your ideal sleep schedule doesn't necessarily need to align with someone else's. The amount of sleep you need depends on your personal needs, lifestyle, and health. The goal is not to mimic the sleep duration of others, but to establish a routine that makes you feel rested and alert during the day. Creating a sleep routine. To develop a sleep schedule that works for you, consider the following tips. Set a regular wake-up time. Regardless of how well you sleep, waking up at the same time each day helps your body regulate its internal clock and feel more alert during the day. Consistent bedtime. Going to bed at the same time each night will signal to your body that it's time to wind down and prepare for rest. Consistency in both wake-up and bedtime creates a reliable routine. Exercise. Regular physical activity can improve the quality of your sleep, but avoid vigorous exercise close to bedtime as it may make it harder to fall asleep. Napping. Napping can be beneficial when you feel tired during the day, but it's important to do it strategically. Naps should be brief, 20 to 30 minutes, and not replace a full night's sleep. Napping too late in the day can interfere with your ability to fall asleep at night. Mind your meals. Eating heavy meals right before bed can disrupt sleep. Try to avoid large meals at least 2 to 3 hours before sleep and limit caffeine or alcohol in the evening. Light exposure. Exposure to natural light in the morning can help regulate your circadian rhythm, making it easier to wake up. In contrast, reducing exposure to artificial light in the evening helps your body prepare for rest. Make up for lost sleep. If you've had a poor night's sleep, don't rely solely on naps to recover. Instead, try to catch up on sleep by going to bed earlier or sleeping in longer the next night. While naps can help refresh you, they shouldn't become a substitute for a full night of sleep. Napping and its benefits. Napping, when done properly, is an excellent way to refresh your brain and body. It can boost alertness and improve performance if you feel tired. However, naps should never replace a full night's rest, and they should have a designated wake-up time to avoid disrupting your regular sleep schedule. The importance of sleep. It's worth noting that according to the American Sleep Association, 35.3% of adults report getting less than 7 hours of sleep on a typical night. This statistic highlights the widespread sleep deprivation in modern society. Developing a consistent sleep schedule is one of the most effective ways to improve sleep quality and overall health. By committing to a regular sleep schedule and considering factors like diet, exercise, and light exposure, you can create an environment that supports healthy sleep patterns, leading to better rest and improved well-being. Focus point 8. Snoring and sleep apnea, diagnosis and treatment. Snoring and sleep apnea are often thought to be related, but they are distinct issues and both can be effectively treated with the right approach. Polysomnography, a comprehensive sleep study that monitors brain waves, muscle activity, and eye movements, is used to diagnose these disorders and determine the best course of treatment. The difference between snoring and sleep apnea. While snoring is common and usually harmless, it can be disruptive to both the person snoring and their sleep partner. Snoring happens when the airway is partially obstructed, causing vibrations in the throat tissues. Most people are unaware they snore until informed by others. It often occurs when a person sleeps on their back, and this position can be corrected by training oneself to sleep on the side. Sleep apnea, on the other hand, is a more serious condition that involves repeated interruptions in breathing during sleep. It occurs when the airway becomes completely blocked, preventing oxygen from reaching the brain. The brain, which requires 20% of the body's oxygen, faces a critical decision during each episode of apnea. Either continue sleeping, risking suffocation, or wake up to restore breathing. This disruption can occur hundreds of times per night. The dangers of sleep apnea. Chronic sleep apnea can lead to significant health issues, as it repeatedly deprives the brain and body of oxygen. Over time, this can result in serious complications such as heart attacks, strokes, hypertension, high blood pressure, heart failure. Treatments for snoring and sleep apnea. Fortunately, both snoring and sleep apnea are treatable. Depending on the severity and cause of the issue, the following treatments may be effective. Continuous positive airway pressure. CPAP, a machine that delivers pressurized air into the airway to keep it open during sleep. This is a common treatment for moderate to severe sleep apnea. Sleeping on your side. For individuals whose snoring is positional, worse when sleeping on their back, sleeping on the side can reduce snoring and improve airflow. Weight loss. Excess weight, especially around the neck, can increase the likelihood of airway obstruction. Losing weight may help reduce snoring and the severity of sleep apnea. Oral appliances. These devices help keep the airway open by repositioning the jaw or tongue. They are often recommended for mild sleep apnea or for people who cannot tolerate CPAP machines. Surgery. In some cases, surgery may be necessary to remove obstructions or correct structural issues in the airway that contribute to snoring or apnea. Other sleep disorders. Apart from snoring and sleep apnea, several other sleep-related issues can affect your quality of rest. These include restless leg syndrome, RS, a condition characterized by an uncontrollable urge to move the legs, often accompanied by uncomfortable sensations. Narcolepsy, a neurological disorder that causes extreme daytime sleepiness and sudden episodes of sleep. REM behavior disorder, a disorder where individuals act out their dreams during the REM stage of sleep, often resulting in injury. Bruxism, jaw clenching, the grinding or clenching of teeth during sleep, which can lead to tooth damage and jaw pain. Parasomnias. These are abnormal behaviors during sleep, such as sleepwalking, sleep talking, or night terrors. Addressing these conditions through proper diagnosis and treatment can significantly improve sleep quality and overall health. If you're experiencing snoring, sleep apnea, or any other sleep disorders, seeking professional help can lead to effective treatment and better rest. Conclusion. Good sleep is essential for both physical health and mental well-being. It impacts your productivity, mood, cognitive function, and overall vitality. Chronic lack of sleep can lead to a host of health issues, including stress, weakened immunity, and increased risk of chronic diseases. To assess sleep quality, sleep studies like polysomnography are commonly used, monitoring brain and muscle activity as well as eye movements to determine sleep stages. For convenience, home sleep testing (HST) has become an option, allowing patients to wear devices that track breathing, oxygen levels, and heart rate at home. However, while this can offer some insight, HST doesn't measure actual sleep quality. It only collects data without assessing whether sleep is occurring or whether it's restorative. Despite the convenience of these tools, the best way to improve sleep is by following simple, practical steps. Implementing good sleep hygiene, such as sticking to a sleep schedule, creating a comfortable sleep environment, and managing diet and stress, can lead to noticeable improvements in sleep quality. Taking naps when necessary and developing consistent sleep routines can also contribute to better rest. If you struggle with persistent sleep deprivation or suspect insomnia, it's important to consult a doctor to explore underlying causes. Your doctor can help identify whether you need to adjust your habits or explore further medical treatments. Ultimately, creating and sticking to a personalized sleep schedule, then monitoring your productivity and well-being, is an effective way to track improvement. By taking control of your sleep habits and seeking professional help when needed, you can enhance your quality of life, boosting both your health and productivity. Thank you for joining us on this journey to better sleep and well-being. Let's quickly recap the key takeaways from the sleep solution. Understanding insomnia. It's not just about lack of sleep, but the frustration and difficulty in achieving restful sleep. Identifying whether you have simple or hard insomnia is crucial. The role of circadian rhythms. Our body's internal clock affects sleep. Disrupting this rhythm, such as through jet lag or irregular sleep patterns, can lead to difficulties. Developing healthy sleep hygiene. From creating a dark and quiet sleep environment to monitoring your diet and avoiding stimulants, simple habits can improve sleep quality. Sleep schedules. Establishing a consistent wake-up and sleep time helps your body understand when to rest and when to be alert. Sleep disorders. Conditions like snoring and sleep apnea can disrupt sleep, but they are treatable with methods such as CPAP therapy, weight loss, and lifestyle changes. Napping wisely. Short naps can refresh the brain but should not replace a regular sleep schedule. Recommendations. Create a consistent sleep schedule and stick to it for a few weeks to see the difference in your productivity and overall health. Pay attention to your sleep environment. Make your room dark, quiet, and free from distractions like TVs or smartphones. Manage stress through mindfulness or relaxation techniques to help clear your mind before bed. Consult a doctor if you experience persistent sleep disturbances or suspect insomnia. The insights shared in this audiobook highlight the incredible importance of good sleep for overall health. By following the simple yet effective strategies covered, you can drastically improve your sleep and, by extension, your quality of life. We've explored the biological, psychological, and environmental factors that influence sleep, and now, it's time to apply these findings to your routine. Thank you for dedicating your time and energy to this audiobook. If you found these insights valuable, please like, subscribe, and share the audiobook with others who may benefit from it. For those looking to improve their English, remember, the more they listen, the better they speak. Keep engaging with educational content to strengthen your language skills while enhancing your well-being. Sleep well, stay healthy, and continue your learning journey.